Hey guys, Dr. Rosa again. Just putting together a talk here for the Good Samaritan Trauma Conference, SCL Trauma Conference. They were able to make some time to talk about wellness this year, and we had a relatively short talk. And my thought was that since this is a nice kind of short one, that it'd be a good one to cover for the YouTube channel. So I'm going to go ahead and go through the presentation again so that you guys can watch it as well. The theme of this one is very much action-oriented. I didn't want to talk too much about the background to burnout, wellness, and things like that, but focus rather on things that you can specifically do to improve mindset, and then also focusing on what you can do to help out your team and the people around you at work. Going to the header here, if you are watching this on a computer, if you just open up your phone and point it at either of those QR codes, the one on the left is the project website that I've put together, and I put a bunch of resources up on there, and that's where I go in and put in updates when I have new stuff. So this will actually be up on there so that you can link to it on the YouTube channel. And then the reading list for this particular talk is the right-hand QR code, and that'll open up a PDF in Google Drive that you guys can have the references that I talk about. There's one reference that I didn't get into that reading list. It was a late add of a slide, but that'll be on the project website if you open that up. So moving right along. Let's talk a little bit about the magnitude of the problem, just to give some context here. So this is a survey that was given to people in the emergency department that looks at whether or not they're suffering from depression, suffering from symptoms related to burnout, and specifically asking questions about, first off, depression symptoms. And these people reported back 60% of them had experienced some depression symptoms. I think for those of us who work in emergency medicine, EMS, emergency nursing, and similar fields, no one's going to be surprised by that number. There's certainly a big overlap between medical emergencies and people who are dealing with depression, emotional emergencies, or have that as just one of their baseline issues that they suffer from. Of those people who reported experiencing depression symptoms, 45% of them had not sought treatment. Again, not surprising at all. A lot of people are in denial about things like this and don't get help. But fully 20% of those people suffering from those symptoms had reported they considered harming themselves. So this issue that we're dealing with is very much a life threat. Now, one thing that I think might surprise you is that if we take a look at where this survey came from, this is actually a survey of emergency physicians. So not patients in the emergency department, but the doctors in the emergency department. This was part of a repeat of a study from 10 years previously. So in 2006, they asked this. 73% at that point had expressed depressive symptoms. Again, about half of them had not sought help. And back then, half of them had considered harming themselves. So my thought is, yes, we know that the people we take care of suffer from medical problems and psychological problems. But the people we work with are also suffering from this as well. And although it looks like we're making some progress over time, although this is a very small study, and it's a self-reported study, or a self-reported survey, so there may be some variability in these numbers from episode to episode of asking these questions. But I think that this really goes to show that, for us in the emergency department, that this is a big problem that we have to deal with. And it's a big problem for our teams and the other people that we work with, even if we don't happen to be suffering from these issues ourselves currently. And it's a nationwide problem. Here's a graph that shows the burnout in emergency physicians by state. In case you're looking at this on a phone, the lightest color is between 25 to 30% of physicians are experiencing burnout, and the darkest red color is between 46 and 51%. So you can see us here in Colorado, we're up in the 40 to 45% bracket. Arizona, where I trained, is certainly one of the highest burnout states for emergency physicians. And so again, I think this is potentially a very big deal. Looking online, I can't find very good data for emergency nursing, although I think it's hard to imagine that if the physicians are suffering this level of burnout, that the nurses are doing much better. I'd imagine they have a lot more stress than we do. And even if we assume that the numbers are similar, the number of emergency nurses compared to the number of emergency physicians is much, much greater. So that makes it a much higher magnitude problem for the nurses. Going back to the physician issue, this is a pretty shocking statistic that I've seen, is that every year it takes 2 medical school graduating classes to replace the physicians who commit suicide in the U.S. in that year. A medical school graduating class is about 200 people. It's estimated based on the number of physicians in the United States that about 400 commit suicide every year. So this is a really big problem, again, for the medical community, but I think we can broaden that out to the other professions that deal with the same issues and work in the same workspace that we do, to think that this is probably a broadly applicable problem. Now, if we get outside of the hospital and look at EMS, here's a study that came out of the National Registry where they sent a survey along with renewal paperwork, so it's a voluntary survey for people who are renewing their paramedic, EMT, or EMT advanced. And in that survey, 37% of the respondents reported they had contemplated suicide, and that's compared to 3.7% of the general population for the United States. So 10 times as much contemplation of suicide for pre-hospital providers than for the general population. And then even more concerning is how many of these people had actually attempted to commit suicide. And that shows 6.6% of these people who presumably are still working, seeing patients every day, showing up to work despite this stuff. They're renewing their license right now. So 6.6% of them compared to 0.5% in the general population. So we're looking at almost 14 times the the rate of suicide attempt in the EMS population. A little bit more recently, here's an article that came out just about a week or two ago, and this came out of the Harvard Business Review. And this was a discussion of a paper that was published by the emergency department at Massachusetts General Hospital, which is the Harvard Medical School hospital. And the folks in the emergency department there published a paper to look at how they dealt with wellness and burnout during the coronavirus epidemic. So this is certainly something that I think is probably much worse after last year, with the financial stresses, the family stresses, people having kids home from school, figuring out how to deal with that, not seeing family, not having social outlets. All of these things combine and are probably causing even worse than the baseline issues that we have with wellness and with burnout in our various fields. Now, one thing that comes to mind, and this is a slide you guys have probably seen from some of my other presentations, is that, for those of us who've done to trainings or courses or, a CE on burnout or seen a presentation on that, there's kind of a standard approach that happens. And so basically they discuss the definition of burnout, and that description sounds a lot like what our normal job description is. They give some scary statistics. We've certainly hit on those. They talk about all these self-care issues of exercise, diet, sleep, mindfulness, and then, kind of wrap up with, this is a pretty bad epidemic and we need to do something about it. Now, I don't want to minimize those 4 issues of exercise, diet, sleep, and, some kind of mindfulness, meditation component to it. Those are all really key, and I've talked about those in some other areas. But what's really interesting when we go back to this article out of the Harvard Business Review is that they talk about what they implemented in the emergency department at MGH, and none of it has to do with any of the self-care issues. So all those things are absolutely key. I think they're extremely important for us to get our heads on straight. But from an organizational standpoint, I don't think there's a lot of play there. I think it's really hard to, as an employer, to really influence how much your employees are doing those things, other than to make it available and to let them know the value of it. I think that really where the rubber meets the road is how do you make decisions in the workplace that can affect how people are engaged with their work. So I'm going to read a little blurb out of this, and there's a link to the article in the reading list. So while there are no easy answers or surefire solutions to burnout during a crisis, we hope that sharing our approach will help other organizations, both within the healthcare industry and beyond. Below, we describe the key strategies we've used. They fall into 6 categories that align with factors that, according to psychologists Christina Maslach and Michael Leiter, drive employee engagement and reduce burnout. And these are rewarding work, autonomy, fairness and transparency, a reasonable workload, a sense of community, and consistent values. And so, these are the things I think where, if we're leaders in organizations, where I think we can really make some progress on improving how people are doing in the workplace. And I think that there's a lot to be said for that. Now, I want to take it back to the issue at hand, which is, what is it that you can do as an individual and as part of a team in this workplace to try to improve things? And certainly the self-care issues are there, but there are certain specific things that I think that you could do as you're working on trying to improve yourself and grow and get stronger, that can have a disproportionate effect on how well the people around you are doing. But first, I want to go back to the title of the talk. What are you going to do about it? Because I think that there's also a certain amount of acceptance and a certain amount of humility that we have to apply to this. Because I really think that from a big picture standpoint, if we look at that paper from MGH and we think about our roles and responsibilities and our scope of influence within our organizations, the likelihood of us being able to implement stuff like that, if we're not the CEO, the CMO, or one of the people very high up in the organization, of being able to implement that stuff and get it done, is probably pretty low. And so I think that, really part of this issue is understanding what your limitations are and accepting those limitations. Because really, for a lot of these issues, there isn't very much that we can do. But I want to also, have a dichotomy here where we also include that there are some things that you can do. And those things reflect on the things that you have control over yourself, and ways that you can improve yourself that can have a synergistic effect on the wellness in your team and in your workplace. So what are we going to do about it? Probably nothing for a lot of these issues. When we think about things like leadership personalities, management style, coping skills, you're not going to change how your boss interacts with the world dramatically. Team personalities, your team members, all have their idiosyncrasies, and they have different coping skills and are dealing with the pandemic and all this related stuff in different ways. There are always workplace politics. There's always budgetary and staffing issues, and those are worse now. There are issues specific to the pandemic, PPE issues, needing to go on quarantine from exposures, thinking about, setting up to get the immunizations, or worry about the immunizations, or reading about, all these different opinions and points of view on it. And then also, we don't live in a vacuum. We don't work in a vacuum. We still have issues with local, state, federal politics, both in how they're dealing with our workplace in the healthcare industry, and then just in general, some of the dysfunction and chaos that's going on at all these different levels that we see in the news all the time. But what about just for you? I think that even though we are going to focus on individual action and individual responsibility for what you can take ownership of, there's an awful lot of stuff that you're not going to have much play for either. You have family dynamics that are very difficult to change. You may have health problems. You may have financial problems, bad habits. No matter how well you're doing, there's always the inevitable unexpected disasters that crop up, and just plain bad luck. We don't have anything that we can do for a lot of these things. Certainly nothing that we can start working on and doing about them if we're in the middle of burnout, middle of depression, and having those symptoms we discussed earlier. And so, I think we just have to accept that, we got to play the hand we're given. We can't focus on all these things that we don't have any play in. We have to really redirect on the stuff that we can do something about. So I think that it's very important to be able to sit in the middle of the burning room, drink your coffee, and say, yeah, there's not much I can do about some of this stuff. But I think also there's a lot of stuff that you can do. So what are some other things that's a downside of trying to engage with these things that are beyond our scope? So one of the things I think is that we have a habit psychologically, especially when things are going bad, for us to over-engage in problems that are beyond our sphere of influence. It's a very bad habit. This is like, I give some examples of being, deeply involved in reading about and watching YouTube videos on political issues, conspiracy issues, or even just, these big, worldwide level problems of, the environment, global warming, all these different things. There are people who spend hours and hours and hours every day engaged with these things when they really don't have any specific thing that they can do about those things that's going to move the needle at all. The upside of this is it gives people a false sense of benevolence because they feel like they're part of something big. And that makes these things very appealing to all of us. We can easily get sucked into these things. But the downside of this is that you get this lack of tangible progress and impact and this feeling of hopelessness because you see this big thing, it becomes very important to you, you learn a lot about it, and then you find out that there's just nothing that you can really do to move the needle on it, and it can really snap back on you. And I think that psychologically, this stuff actually occupies the part of our brain that we use for religious experience. And so a lot of the, if you read a little bit more on these phenomena, these big picture things that people get deeply involved in, that's really beyond their scope and beyond their power to do much about, they start to take on the personality of a false religion. And so it can become pretty dysfunctional to take up a lot of your time. If we're doing that, we can also find ourselves in this, in some different manifestations of this. My favorite manifestation of this that I suffer from badly is, I like to call it social media pontification death matches with strangers. This is when you're flipping through social media and you see a post or you see a comment where someone is just 100% wrong, and you decide this is your opportunity to just straighten that person out, tell them what's what. It's almost entirely pointless. Nobody gets their minds changed on social media. It's actually designed to reinforce what you already think. So it's never going to happen. That's not the forum to be able to change people's minds. And it's really not a great use of your emotional energy. I'd say a bigger time waster is spending more time on news and politics and just reading up on this stuff and following it than you do on the stuff that you're doing for yourself to improve your health, your well-being, or your strength, or your skills that can help you at work. I think another big downside of this is it tends to worsen our relationships in the real world. When we're engaging on these things and we have these, we end up sucked into these social media rabbit holes of all these different kinds of issues, it can make us not the best people to be around because we're just so focused on these things and focused on the disagreements with these things. And, I can think back both to, things that I've done and things that friends and family have done over the last year. And, think back to your own situation. How many of your friends and family are now more distant than they were before COVID, 2020 elections, and all the election aftermath? I know lots and lots of people who've just gotten in fights and arguments with family and close friends where they're just not as close anymore, and they're fighting over stuff that's just way beyond the scope and way beyond the things that are really important, the things that matter to us every day. So, going over all those different negative issues and getting a grasp on those and accepting the fact that those are just reality, I think that sets us up to be in a good spot to say, well, what are the things that we can do about it? Because there actually are a lot of things that we can have some play in. And I like to use this analogy of land navigation, map and compass. I come out of the search and rescue community before I went to medical school. Land navigation is important to me. I still hunt and hike and do a lot of outdoor stuff. And so I think it's a really good analogy for how you can consider where you are and what you should do next if we're looking for actionable items here. So I think you first have to take a quick self-assessment and sit down and really look at yourself and say, where am I right now, and in which way am I going? And I think there's kind of three general possibilities that we can come to here. I think that if things are going relatively well and you're fairly optimistic and you're in a good headspace, I think you can say, you know what, I'm doing okay and I'm making progress towards my goals. If that's true, then I think a lot of the action items that you need to look for and things that you can incorporate are going to involve what you can do to maintain your forward progress. Also thinking about, are you really headed in the right direction? Or do you need to adjust a little bit? Do you need to, tweak things a little bit one way or another? Also, as for someone who's gone through a whole bunch of family disasters, workplace issues, all kinds of things over the last several years, are you ready to handle the unexpected? Do you have a bad day plan in place, which we've talked about in previous lectures? Are you taking good care of yourself? Are your bad habits under good enough control that if this unexpected comes in, it doesn't just completely spin you apart? And then also, am I becoming complacent? Are you taking for granted how well things are going right now to the point that you're not engaging and you're not growing? Because this can end up leading you to the next spot, which I think is the another place many of us end up, and maybe where most of us end up, especially if you're spending the time to look at a talk about burnout, is probably feeling like you're stalled out and you're stuck and it's hard to get moving and you don't know which direction to go in. And again, I think the majority of us likely feel this way who are watching this. And I think the issues here that you want to look at if you're looking for actions is to figure out, how do I get moving again? One of the things that's helped me when I get stuck and feeling this way is I think back to what's worked before. What are things that I've engaged on and incorporated into my daily routine that's gotten me moving? Because those habits, old habits that are good, are easy to reinstate and get moving again. And then also, if you don't know which direction to go in, is there a particular direction that has your attention that's calling out to you? Can you start heading that way? And sometimes we feel like unless we can find the perfect direction, the perfect solution, we don't want to do it. And we end up in this perfectionist fallacy of, I don't want to do the wrong thing and waste time. But you got to get that out of your head, because movement in the wrong direction is better than no movement. Because if you're moving, you can always adjust course. You can always fine tune which direction you're going in. And if you end up going in completely the wrong direction, you're going to find that out pretty quickly. And that's going to give you more information which way the right direction might be. But the flip side of that is if you stay in a bad spot, things are going to progressively get worse over time. It is impossible to stay in place in life. You're getting older, time is moving on, the world's moving on without you, other people are moving on without you. And so, getting up and getting moving is absolutely key. I think also we have to be humble in how we do this. You don't want to just walk off a cliff in the dark, which, figuratively is a problem here, where we can get just so energized and so panicked that we just jump onto something that's just in a crazy direction, throw so much time and energy into it that before we can correct course, we're just over dedicated in that direction. And I mean, this is parallel to the reality of search and rescue. We'd go looking for people and find them at the bottom of cliffs where they just basically got lost and panicked and walked in the wrong direction in the dark and fell to their deaths or fell to severe injury. So this is something that happens in the real world. It's something that happens psychologically to us as well. I think that also, if you're looking at a lecture on burnout and workplace wellness, you may find that when you do this assessment, that you find out that I am actively going the wrong way. And, this is key. I think that self-sabotage is a real thing. We are complex animals psychologically, emotionally, neurologically. And we can get our heads so wound around themselves that we actively do things that are harmful to us out of spite, out of bitterness, out of just, self-destruction. And so if you find yourself going that way, I think that we have to, dig a little bit deeper. First and foremost, is your bad direction currently a life threat? Because if that's the case, I want you to just stop this video right now. Go to the reading list. There's some resources on there. Go get help right now. You're going to get way more out of getting help for a life-threatening level of heading in the wrong direction and life-threatening level of depression if you get active on that rather than hurt yourself. Because you guys are important to me. You're very valuable. If you keep going down a path of self-destruction that's threatening your life and we lose you, you're going to leave a big hole. And that's just something that you don't want to do to your friends. You don't want to do to your family. So just disengage right now and go do that. Here's some places you can go look. So Code Green campaign is out there. This is not specific to, but most of it's focused on EMS, fire, law enforcement, out of hospital stuff. But there's some generalizable resources in there as well. On the reading list, I have the National Suicide Helpline. If you want to take advantage of that, they'll have some resources there too. Locally, Foundation 1023, which is Mel Mesmer is a big player with that out of Centura. This is available online too. They have tons and tons of resources. Again, focusing on first responders, pre-hospital environment, but there's if you need help, there's something in there that can get you some help. Several states have different resources. One page that I really like is out of Arizona. Ben Bobrow, who's was my fellowship director back in the day. He turned me on to this page that they put together when he was the state EMS medical director there. And they have a bunch of resiliency resources, stress, self-care, other things that are very useful that aren't necessarily specific to Arizona itself, although I know some of you guys in Arizona are going to be watching this too. So there are some resources for you there. So let's assume that you're not having a life threat right now. Is your bad direction putting your family relationships at risk? And I put this up there right behind the life threat issue because although there is a little bit more time to get that sorted, that's something you need to focus on fixing urgently because we really are social animals that require family around us to function. And if you're doing things that compromise your family support system, it'll undermine you in essentially all these other areas. And I would actually add into that not just blood family, but some of our very close friends who basically function as family for a lot of us, or we have relationships as strong as we have with our family members. So if this direction you're going is really compromising that, you need to get on top of that right away because losing your support system, it's just going to make everything else 10 times harder. So is your bad direction putting your career at risk? That I'd like to speak to specifically when we talk about things that we can do that are going to help us and how we interface in the workplace. But if you're dealing with burnout, one of the primary risks of workplace burnout is because you're fed up with your job and you're not doing it as well. Just remember that people who don't do their jobs well don't end up sticking around. They either end up getting in trouble and quitting, they end up getting fired, they end up getting not getting promoted, getting demoted, or other things. And I think also many of us have been in organizations or on teams where people who aren't doing their job well and are burned out end up sticking around. And what happens is they tend to destroy the team around them. So if you're in that situation, getting yourself straightened out to the point where you can interface better with your team is going to help your team because it's going to make you a more valuable part of it. It's going to make you more productive, more engaged, and you're going to help the people around you by helping yourself because you're going to be less of a burden to them in the workplace. So that's one of the big places we can focus. I think also if we're looking at map and compass is figuring out where you fit in your team, especially when we start talking about the workplace. So if you look at this and you say, well, I'm really a leader in my organization. I'm a medical director myself. I've been in charge of various committees and various other things where I actually get to participate in some of the higher level leadership decisions for organizations. If that's who, that really fits your picture of where you see when you're doing the self-assessment, you actually may have some more leeway on implementation of some of this stuff for the organization. But I think you also have to remember that you may be part of your team's problem. If I am being dysfunctional and I'm not interacting well and I'm procrastinating and I'm not achieving on the things that I need to do as a leader, as a medical director, and someone who's responsible for a lot of things in my organization, I'm going to be creating problems with wellness and burnout in the other people who are in the organization, the people around me. So I got to always think about, am I part of my team's problem before I start, trying to implement good idea issues? What if you do this assessment and you say, you know what, I'm at the bottom of the totem pole. I'm the new guy. Nobody reports to me. Everyone in the chain of command is above me. I think that you also still have a lot to do to help team dynamics by addressing your own issues. By you becoming more strong and responsible and engaged, that's really going to help the workplace in general too. Even if you end up finding out that you're in just an exceptionally dysfunctional workplace where you have to move on, getting yourself straightened out is going to help in making that more possible and giving you more opportunities. So I think that's worthwhile. But, I think in reality, if we look at this, almost all of us are somewhere in between. We are not necessarily the top of our organization, not necessarily the bottom. And this is a universal and eternal issue. You can even look back to, into literature, back into religion. This is out of the New Testament. So this is from 2,000 years ago, the story of the centurion who goes to Jesus for help because one of his servants is sick. I just love this line when we start thinking about, workplace issues. For I too am a man set under authority with soldiers under me. So this guy's saying, I'm a middle manager, but I get how the chain of command works. I say this and people do it. I say that, people do it. And, please help me out because you seem to be a thought leader on this issue and you seem to be someone who can help this guy who's working for me who needs some help. So, this problem is at least 2,000 years old. You have people writing about these similar issues, incorporated into things that have come down to us, for example, like in the Bible. So what are we going to do with this stuff if we are reaching out to look for help and we've done this assessment? I think you really got to start humble. One of the things that you can do is shrink down your time and your space horizon to something that you can manage. You can't be making 5 and 10 year plans if you don't know what you're going to be doing at work tonight, or if you don't know how you're going to get through your shift tomorrow. So you got to really narrow things down and focus it. And I think that when things are going bad, focusing on one day at a time, which is just such a cliche, but it's so true. How am I going to get through today better off than I started the day? And what am I going to do? You need to pick something to do. And there's a million things out there. I'm going to talk about some specific stuff to the workplace, but you need to pick something that's calling out to you, but it needs to be something doable, which both means it's something you're capable of doing and something that is within your willingness to do it. Because we might be capable of doing something, but we're just in such a bad headspace that we're just not really willing to get up every morning and go, run 5 miles a day. That's not something we maybe are ready for yet. I think it's very helpful to pick something that's measurable, that you can track, that you've done every day. And I think also it's tempting as you start reading about all the different things that you can do from, self-improvement for work-related stuff to just general self-improvement literature. You end up tempted to just take on 5 or 6 different things at once. And I would say don't do that. I would say pick one thing that is doable, measurable, and that you can do every day and start doing that one thing. And if you start doing that every day, you're going to build a habit. If you look at the habit literature, there's this 21-day, 3-week magic number that a lot of the studies and research on habits have looked at, where if you basically do this one thing every day, that's for 21 days, then it's easy to get that established as a habit circuitry in your brain. If you want to read more about habits, these 4 books are really good. The first one that I read was actually The Slight Edge by Jeff Olson. That's a general self-help book that's focused on career issues and workplace issues and an incremental. The theme of it, the Slight Edge issue, is this idea of incremental improvement, of doing one thing a little bit every day to make progress. And if you make a small amount of progress every day, that adds up like compound interest. So that's a really cool book. That's the first one I read. My friend Ethan Ross recommended that a couple years ago. The next one that I had read was The Power of Habit by Charles Duhigg. That's top left one. That talks about some of the neuropsychology of habits and how they work, both bad habits and good habits. And it covers some of the 21-day issues, how to establish a habit, then how to start chaining habits together. The James Clear book, Bottom Right, Atomic Habits, he talks a lot more about using these small habits as building blocks, where once you establish one habit, you can start adding and chaining together multiple habits to build a routine. I've used that to build a morning routine that I try to do every day. And when I'm able to do that every day, I found that's really helped me to get moving in the morning, get a lot of stuff going in the morning, get a lot of work done early in the day. The Happiness Advantage by Sean Aker, he covers some of these habit issues, but lays that into some of these concepts related to mood and positive mood, positive affect, and how those things then can come back and improve your function at work. And talks about how that can have a big spin-off into how you're doing in the workplace. So those are all 4 useful books that cover that topic if you're into reading some books. One of the things out of the Happiness Advantage that I really liked was he talks about this 20-second rule. And what the 20-second rule is that if you're trying to make a new habit or break an old bad habit, this 20 seconds is key. So it plays on the fact that we're lazy, that if there's a barrier in front of us and we're disinclined to do something, we're likely to engage with whatever that barrier is and not push forward. So for a good habit example that he uses is, okay, let's say the habit you want to establish is you want to get up in the morning and exercise. Well, his idea is just go to bed. Before when you go to bed, get your exercise clothes on and go to bed in them. Then when you wake up in the morning, hey, I'm already dressed to go for a run. I'm already dressed to go to the gym. I guess I'm just going to go to the gym. And by doing that, it's going to make it a lot easier to be able to engage on that. The 20 seconds harder to break bad habits. My thing that I do is I'm a big fan of cookies. And so if I can get those cookies to where they're harder for me to get to, I'm lazy enough that it's just like, you know what? It's really easy for me to not get to those cookies. Another thing that's useful that I found that plays on this 20 seconds issue is that if I'm in the habit of logging calories for the day to help with my issues I struggle with weight, the fact that it takes me 20 seconds to log in 3 cookies into one of those calorie apps means it's way easier to just have a glass of water or some of the no calories in it because I don't have to bother logging it. So again, take advantage of your laziness to be able to break these bad habits or to make new ones. I think that you can also make a lot of progress if we look at organization and planning. So is your life really disorganized? Is your workspace disorganized? How many emails are there usually in your inbox? Right now, I think I'm down to 2 because it's about 2 o'clock in the afternoon here. But I try to get to a point each morning where I have 0 in my inbox and I've moved all of my emails. Either I've addressed them, deleted the junk, or moved them into a task list where I'm going to schedule this and do that task later on. That makes a huge difference because then I don't have to worry about those dragons that hide in the inbox or things that I've forgotten about in the inbox. And I think that makes it easier if you're able to keep up on your workplace communications. It makes you an easier person to work with. So that's really going to improve the wellness of the people around you because they're not all waiting for you to do stuff, or you're not forgetting things, or they're not having to remind you about stuff. One of the things that comes out of the David Allen book is this 2-minute rule. So if you're handed something, you get something in your inbox, something shows up in the mail, and you can handle that in 2 minutes or less, do it right now. Because it will take you more than 2 minutes to store it away and find it later and do it later. And you'll find that a good chunk of the things that you need to do that are coming to you throughout the day, I'd say for me about 3/4 of them are things that I can knock out in 2 minutes. And so if I can just get that done in real time, first off, it's going to blow people's minds because you'll get an email from somebody and you'll send them the answer to that email and solve that problem right away. It's going to look like magic on the other end. And the other thing is it really gets rid of that big backlog of those little menial tasks that pile up. Because if you have 30 things that have piled up that take 2 minutes to do, that takes an hour of your day to burn through all of those if you actually engage with them. And generally, they're not super rewarding things if you're knocking them out in 2 minutes. So just get them done in real time. He also goes over a bunch of stuff on bigger picture project planning, structuring your calendar, structuring your to-do list. Very helpful stuff. So those are some issues if you want to talk about some kind of low-level things that you can incorporate pretty well. If you want to talk more about big picture stuff in the workplace, I think one of the most useful people I've heard about is Jocko Willink. Read his books. I've actually gone to a couple of his conferences that he puts on, and his podcast is very valuable. So he's got a couple books on effective leadership. He comes out of the military and has some kind of a military perspective on stuff, but the things that he's talking about are just universal leadership issues because they're based on human psychology. His podcast in general are book reviews and interviews. If you want to listen to a really good one, podcast number 98 from a couple years ago is good. He interviews a guy named Jordan Peterson, and they talk about how important it is to do these things and take responsibility for what's going on, how important it is to have meaning in your work and to find meaning in your work, and to do things. It's a little bit on the dark side, but it's one of the best ones. I've listened to about 4 or 5 times now. And when I kind of get into the weeds, I tend to pop that on a podcast if I go for a run or I'm on a long drive and revisit it, and I kind of hear new stuff each time. His shtick is kind of this get up early and get after it issue, which I think is really key. I think the most productive part of the day is the first part of the day. And if you can get up before other people are up, you can get a lot of stuff done, especially if you're engaging with your inbox and answering a bunch of emails. If you do that at 5 o'clock in the morning, you're not going to get a lot of real-time responses from people. And so it actually, pushes off the responses until later in the day. But again, the big thing here is just taking responsibility. And this gets back to the initial thing that we talked about. All these problems you see are your problems, and blaming others is not going to help with that. But you need to be humble, because it doesn't mean you need to take on the entire world and all the problems in it every day. You got to remember that humility. You have to be able to recognize what of this stuff are things that, although I am responsible for everything that's going on around me, what of that stuff do I actually have the ability to change and improve? Because, blaming people, blaming the system, blaming politics, blaming, some big nebulous, issue that's way outside of our control, that doesn't help. That just offloads your responsibility to do stuff about what's going on. But you got to pick things that where you can be effective, and you can't burden yourself down while you're trying to do it by over engaging. One thing that's come up, I know, talking to some of my colleagues who are women, is that Jocko's message, he's a little, he's a big Brazilian jiu-jitsu, self-described meathead knuckle dragger guy. He doesn't really resonate with some of my female colleagues, but some of them have gone and this has come out in the last month or two that they started this year. So Echelon Front is his company that he has that does business consulting, and they've been putting on these free women's assembly webinars. They're about an hour long, and and I've heard that they're really good. Obviously, not being a woman, I haven't looked into them to watch those. But some of the folks who I've recommended this to said they're really good, and they have a bunch more that are coming up in the next few months. So if you go to the Echelon Front website or Google Jocko Women's Assembly or Echelon Front Women's Assembly, this will pop up. There's a little registration site in there. You can check that out. And there's a link on the reading list too. Another issue that can come up, and this was a bit of a late ad of a slide, is maybe part of the problem that you're having and where you can improve is that you're not really good at negotiating for yourself. Either you are too blunt and aggressive and you turn people off, and people have just decided that you're problematic and they're not going to give you anything you ask for. I know a lot of people who have that issue. I have that issue sometimes myself. Or you can just be a pushover and never negotiate for yourself and end up feeling just kind of bitter and resentful that you feel like you're being walked over all the time. So this is a really good book I read recently by a guy named Chris Voss. He used to run international hostage negotiations in the FBI. So he's coming from a hostage negotiation standpoint. The thing I like about this guy for the negotiation stuff, though, is even though he's coming out of this, law enforcement, kind of, aggressive type A environment, his approach is really much more focusing on the emotional aspect of negotiation. And then he also talks about how if you read some of these other negotiation textbooks out of the business literature or self-help literature that are just very much, zero sum, I need to win, the other guy needs to lose, we're going to beat the other person, very confrontational approach to negotiation. He talks about how that's just deeply dysfunctional and how it generally backfires and is generally unsuccessful. Or if it's successful in the short term, it's unsuccessful in the long term because it undermines relationships with these people that you're negotiating with in the workplace. And really focusing on the issue that people negotiate from emotionally held positions. We think we're logical animals. We're really not. We have logic, but unless you are emotionally behind the thing that you're negotiating for, or emotionally behind the end point of a negotiation or a solution, you're not going to feel really satisfied. And so, understanding that in yourself and understanding that's where other people are coming from is really key. And that I think that, especially in healthcare, almost all of our workplace interactions are part of an ongoing negotiation. We're negotiating with patients to take their medication or interact with us or, tell us what's going on or, agree with follow-up issues. We're negotiating with each other. We're negotiating with colleagues and consultants, with what we need to get done for our patients. And even just, you get a busy shift and you need to talk to your coworkers about helping you out, so we can get through. That's a kind of negotiation as well. So this one's not on the reading list, but if you go to the website, the project website, there's a link to it on there. So again, what are you going to do about it? I think it's a combination of accepting the disaster that's around us all the time, and there's not much that we can do about a lot of it, but identifying which things we can take responsibility for and we can improve on, doing something small, doing it every day, getting stronger, getting headed in the right direction. So again, what are we going to do about it? Probably not very much, but I think the small things that you can do will make all the difference. So pick something that's calling out to you and get after it. Stay safe. If there's issues that are just undermining you and you're in a dangerous spot, make sure you're getting the help you need. And otherwise, just work on getting a little bit better every day and being humble about it. Don't beat yourself up. Do what you can. So going back to this, we've got the project website. I'm going to put this up on the YouTube channel too, and I'll put the links into the description for the project website and the reading list. Or like I said, point your camera from your phone on this if you're looking at it on a computer, and it'll show you, it'll take you as a link to right there. I've got stuff I put up on project related, put up on Facebook and Instagram if you want to follow that as well. Those links are on the project website main page. You can get to that. Reach out to me if you guys have any other questions, if you have any other topics you want me to cover. And thanks for sitting through this discussion. I hope that there's something helpful for you that you guys can incorporate into what you're doing out there. Take care.